My name is Bailey Zellers and I'm an RN student at Vernon College. I'm going to be doing my head-to-toe assessment. I've already washed my hands and I've provided privacy for the patient, and I've gathered all of my utensils like a pen light, paper clip, tuning fork, something to test cranial nerve 1, a tongue blade, and a reflex hammer. I'm going to start by introducing myself to the patient. Hi, my name is Bailey Zellers. I'm an RN student at Vernon College. I'm going to be doing a head-to-toe assessment. This is going to be a series of personal questions and some physical activities. Is that okay with you?
Yes.
Okay. Can you state your first and last name, please?
Claire King.
Okay, Claire, do you know where you're at today? Do you know what day of the week it is?
Sunday, November 22nd, 2020.
Do you know who the President of the United States is?
Donald Trump.
Okay. I can tell this patient is alert and oriented to time and situation. This patient's thought processes are normal. They're within normal limits. So then next I would go along with just looking at her. Her posture is normal. She's not slouching. She doesn't have any kyphosis, not any scoliosis that I can tell. Next I would look at her skin. I would see that there's not any lumps or abrasions. Her skin is all intact. I would look at the bony prominences, make sure there's not any tears or nodules. Everything looks good that way. She's well groomed. No wrinkled clothing. She's got makeup on. So then next I would just dive into my assessment and look at the head. This patient's head doesn't have any type of abnormalities. She doesn't have any lump or lesions. I'm just going to palpate after inspecting. There's no dandruff, lice, or anything like that. So then next I would move on to cranial nerve 5. This is going to be the motor function. So I'm going to test the muscles here. I'm going to have her clench her jaws. Okay, I can feel her muscles there working properly. So then I'm going to grab my paper clip and I'm going to test. I want you to test for dull or sharp sensations, okay?
Tell you what it is?
Yes,
Dull.
please. Close your eyes.
Dull. Sharp. Sharp.
Okay, now I'm going to test for cranial nerve 7. That's going to be her whole face. It's a facial nerve. So I'm going to have her smile, frown, and puff out your cheeks. Okay, the cranial nerve is intact. So now I'm going to go along and check her skin. I'm going to feel with the back of my hand. It's warm, not hot, but warm. There's not any abnormalities, like I said before. And then there's going to check her fingers. Her fingernails look normal. They don't have any deep crevices. There's not any clubbing. I'm going to check the refill. It's less than 3 seconds. So now I'm going to go to the eyes. So first I would inspect the eyes. I'm going to look at the lacrimal apparatus, which is your tear ducts. I'm just going to push and make sure there's not any leakage or drainage or obstruction. Now I'm going to pull down her eyes and have her look up. And then her sclera is white and the conjunctiva is pink. Now I'm going to test for her pupils. I'm going to use this light. First I'm going to check for direct pupillary response. So I'm going to have the light and look at her pupils and make sure that they constrict. So look, constriction, constriction. So now I'm going to do the indirect light where I put my hand here. I'm going to move this light to this eye and make sure that her other eye constricts. Okay, constriction. So those are all good. Now we're going to do accommodation, which is the last in Perlo. You got pupils are reactive to light and accommodation, and they're equal. So accommodation is going to be where I have you look out to the paper towel dispenser, and then I have my pen light here, and so I'm going to have you, when I tell you, look at this pen light. Look at the pen light. Okay, her eyes constricted to the pen light. So now we're going to test for convergence along with the extraocular motor function. That's where I'm going to have her start here, and we're going to follow. I'm going to have you follow my pen light, okay? So we go up, back here. So this is testing for cranial nerve 3, 4, and 6. Okay, and then now follow my pen light. All right, her eyes converged and everything else was intact. So now I'm going to look at the ears. So for the ears, I'm going to be looking at the tragus and the auricle of the ear. So I'm just going to make sure it's all in a normal shape. There's not any lumps or lesions or abrasions. Everything looks good. I would grab my pen light and look inside. I don't want to see any excess earwax, which is cerumen. Make sure that they're patent. Then I would test the tragus and make sure that they rebound. Is there any tenderness here?
No.
No? Okay. So then next we're going to do the hearing test, which tests cranial nerve 8. There's 3 different types of tests. The first one I'm going to perform is the whisper test. So I'm going to get at like an arm's length from my patient here, and I'm going to have her cover one ear and whisper something and have her repeat it back to me. Okay, so
Apple.
okay, and now cover the other ear, please.
Banana.
Okay, she passed that test. So now we have the Weber test, which is where I'm going to use my tuning fork. I'm going to hit the hammer and place it at the top of her head and ask if she can hear the vibrations in both ears. Can you hear?
Yes.
Okay. So the Weber test was negative. Next we're going to do the Rennie test, and that's where I'm going to hit the hammer and place this, the base at the mastoid process, and then have her, after she can't hear that, the vibrations any longer, place the bells at her ear, and once she can't hear that any longer, then we'll know if she passed or failed the test. So this is air conduction and this is bone conduction. And air conduction should be twice as long as bone conduction. So I'm going to measure it with my watch.
Okay. Okay.
Okay? And so her air conduction was twice as long as bone conduction. Next, we have the nose. So I'm going to look at her nose and make sure that's medial and symmetrical. It's in the middle of her face. There's not any deviation to one side or the other. The color is normal. There's no cyanosis. There's not any like blackheads or anything. It's just a normal looking nose. So now I'm going to palpate sinuses. So then I'm going to press here. These are the maxillary sinuses here on the lateral sides of the nose. Tell me if you have any tenderness.
No.
Now here's the frontal sinuses here, the top of the head, or like the forehead. No? Okay, so those are good. So now we're going to test for patency. I'm going to have you close one nostril and breathe in. And then do the other side. Okay, so both nostrils are patent. Now we're going to test for cranial nerve 1, which is the olfactory nerve. I'm going to have her close her eyes. And please smell this and tell me if you know what it is.
Coffee.
Okay? And it was coffee grounds. So cranial nerve 1 is intact. Next, I'm going to look up inside of her nose and make sure there's not any abnormalities, any polyps, or a deviated septum. They look good. They're clear, patent, and white, and no drainage. So then next, we're going to move to the mouth and throat. I would first start by looking at the lips. The lips are moist, not dry. She has lipstick on, but they're normal in color. They're not cyanotic. I would have her open her mouth, and her tongue is moist and pink. The cheeks are moist and pink. Her teeth look good. There's not anything missing. They're clean. They're all intact. The tonsils are absent. I'm going to have her say, ah.
Ah.
Okay, and that shows that the uvula raises up, and that tests cranial nerve 10 and shows it's intact. I'm also going to have you stick out your tongue. Okay, it looks medial. I'm going to grab my tongue blade, and I'm going to have her push her tongue to both sides to test cranial nerve 12, which is the hypoglossal nerve. So move to the left, please. Stick out your tongue and push it to the left, and then push it to the right. Okay, she passed the test. Cranial nerve 12 is intact. So moving right along to the throat. So, the neck. So I'm going to inspect the neck, make sure that it's medial, There's not any deviation to one side, which would suggest pneumothorax. So it looks good. I'm assessing for any lesions, lumps, or masses. It looks good. Can I have you swallow for me? Okay, she swallowed on command, and there wasn't anything blocking her swallow, which tests cranial nerve 9 and 10. So then now I'm going to assess her lymph nodes. So starting at the base, at the base of the head, which is the occipital lobe, back here. Then you have your post-auricular lymph nodes. Then your pre-auricular lymph nodes. Then you have your tonsillar lymph nodes down here by your tonsils. Then you have your submandibular, which is like at the cheek, and then you have, like at the jawline. And then you have your submental, which is at the chin. And then you have your deep cervical chain, which are, you have the anterior, which are in front of the sternomastoid muscle, and then you have the posterior, which are behind the sternomastoid muscle. And then you have your subclavian lymph nodes, which are here, and I'm going to have you shrug your shoulders, please. Okay, I couldn't feel any there. So now that I'm here, I'm going to have you shrug your shoulders to resistance. Alright, that tests cranial nerve 11, and it shows that it's intact. So now I'm going to palpate your trachea. Again, just testing for making sure that it's midline. The trachea feels good. There's not any abnormalities there. So then now I'm going to have you lay down for a second to check the JVD, which is the jugular vein distension. That just shows if there's any poor circulation or any signs of heart failure. So I'm going to have you look up and turn to the left. Okay, it looks good. No distension. So I'm going to have you raise up. I won't do that yet. Okay, so now I'm going to assess the thyroid. I like to do the posterior approach. So I'm going to get behind her and grab both my hands here, like at the trachea, and have her look down and to the right and have her swallow. Okay, no abnormalities there. Everything feels great. So then I am going to actually auscultate her thyroid. I'm going to use the bell of my stethoscope here to feel the, to hear any bruits or any whooshing sounds, anything like that. So I'm just going to hold this here. Can you swallow for me? Okay, everything sounds great. So now I'm going to feel for the carotid artery. And you only want to feel one at a time, because if you press both, you could cause the person to pass out. So I'm going to feel on this side. Now I'm going to feel on this side. Okay, they both feel good. No irregularities or any distension or anything like that. So now I'm going to auscultate the carotid artery with the bell. Okay, everything sounded great. So now I'm going to do the reflexes of her arms and hands. So I'm just going to look at it, palpate it. Is there any reason why I couldn't do any reflexes on your arms? Okay. So I'm going to get my reflex hammer. And the bicep reflex is here. I'm going to place my thumb here. Her arm should flex up slightly once I hit this point. Okay. That was good. It was a brisk 2. While I'm here, I'm going to hold your hand this way and get this radiobrachialis tendon here. So I'm just going to hit it slightly. Okay, the thumb reflexed. And so now I'm going to do the tricep reflex, make her arm kind of out like this, and hit that olecranon nerve, or that olecranon process here. I wouldn't put my thumb there, I'm just going to hit it, and then her arm is going to extend slightly. Okay, so all the reflexes were good. They were a 2, a normal brisk reflex. So now I'm going to check her radial pulse now that I'm here. I would assess it for a full minute, but the pulse, it feels good. It's not bounding. It's at a +2. No irregularities. No thrills. It feels great. So now I'm going to have her test the hand grips. I'm going to have you squeeze both my fingers as hard as you can. Okay, good. Bilateral equal strength in both hands. Next, we're going to do the thorax. So I'm going to start with the posterior thorax. I don't need any tools besides my stethoscope. So now I'm going to do the fremitus. So I'm going to put my hands here and have her say 99.
99.
99.
99.
And one more.
99.
Okay. Next, I would check for chest expansion and put my hands here at the rib cage and have you take a deep breath in. Okay. Both of my hands moved equally and symmetrically. Next, I would auscultate. Well, first percuss. Well, let me auscultate. And then you would do it in a side-by-side motion to compare each side. Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. Okay, and you want to make sure you get the lateral sides as well. One more. Okay, and now this is when I would percuss. I'm going to get my hands here. Okay, now moving on to the anterior thorax. We're going to start the same way and first look at her respirations, make sure they're even. Labored, she's not using any accessory muscles to breathe. She's breathing just fine. I'm going to check for chest expansion. I'm going to put my hands under her ribcage here and have you take a deep breath. Okay, they moved equal and bilaterally. So now I'm going to check for fremitus and have you say 99.
99.
99. And one more.
99.
Okay, I could feel the vibrations in all different lobes. So now I'm going to auscultate. Okay, you can just breathe normally, that way you don't get out of breath. But I would have her take a deep breath at each spot. Okay, sounds good. Now we're moving on to cardiac. First, I would like to inspect and palpate the apical pulse, which is at the 5th intercostal space. So it's probably like, in women it's usually like under their breast or like, you know, like right in that space. It's kind of hard to get to. But I would feel it, palpate it for a full minute. Then I would listen to all 5 traditional spots, starting with the aorta. So the aorta is over here to the patient's right side at the 2nd intercostal space. And I would listen with the top 3 points with the normal base of the stethoscope, and then I listen with the bell on the bottom 2 spots. So moving over to the pulmonary, or pulmonic, and then going to Erb's point at the 3rd intercostal space, then the tricuspid at the 4th intercostal space, and then the mitral down at the 5th intercostal space. So next, I'm going to have you lay down and inspect the abdomen. So first, I would make sure that the umbilicus is midline, in the middle of the body. There's not any abnormal, like the abdomen is symmetrical, it's even, round. So then I would get my pen light, and I would check for any peristaltic waves. So I'm going to look and make sure there's no peristaltic waves. Everything looks great. So then now, with the abdomen, it's important to inspect first, then auscultate, then percuss, then palpate. Because if you go to percuss or palpate, you could disturb the bowel sounds, and it won't be a true reading. So now that I've inspected, I'm going to auscultate. And you want to start in the right lower quadrant and work in a clockwise motion, circular, right lower, right upper, left upper, right lower. So now I'm going to auscultate. Right lower, right upper, left upper, left lower. And then I'm going to flip my thing over to the bell and listen to like the deep vascular parts. So I'm going to listen for the aorta, which is slightly to the left of the umbilicus, for the aorta. Then we're going to listen to the iliac, which is kind of on the iliac crest. And then you're going to listen for the femoral artery. Next, you're going to listen to the spleen, and then to the liver. Okay, and then next you would percuss. So I'm going to get my fingers and percuss, and you want to hear tympany. You don't want to hear not tympany because it could indicate something wrong with the bowels. Next you would palpate. So I'm going to lightly palpate, and you just tell me if you have any discomfort, okay? Then I would palpate the spleen up here, and then the liver. Okay, now while you're laying flat, I'm going to assess the legs. The legs they look warm. They're warm and dry, but not too dry. They're just a normal dry. There's not any edema. There's not any varicosities. Everything looks good on the legs. There's not any tenderness or bruising. I would test the dorsalis pedis here, like the pulse. And they're even, bilateral at a +2. Then I would check the apial pulse back here, or it's like the tibial pulse. And they're equal at a +2. Next I would test for the dorsiflexion and pedal strength. So I'm going to have you put your feet towards you against my hands. Okay, good. Now push my hands down. Good. Everything looks good that way. So I'm going to have you sit on the side of the bed now. Oh, before you do that, I forgot to do the heel to shin test. So I'm going to have you get your heel and then put your shin. Okay, good. And then do the other side. And then that tests for cerebellar function. Okay, now you can get up. Yes. So now I'm going to test the reflexes of the patellar and the Achilles. So I'm going to use the base of the reflex hammer here. Okay. Alright, all reflexes were good at a 2. They were brisk. So next I'm going to check for her sacral edema and make sure that there's not any edema back here. On a normal patient, you would get them undressed to assess their full back and bottom, but you would check the sacrum down here, which is the tailbone area, and check for edema. There's not any edema present. So now I'm going to have you stand up, and gently, yes. A patient who is bedbound, if you try to get them up, they could result in orthostatic hypotension. So are you having any dizziness? Okay. I'm going to have you walk across the room for me from your toe to heel, heel to toe, all the way across, and then walk normal back. Okay? All right, the patient has a steady gait, no swaying or any type of trouble with walking. So now I'm going to have you close your eyes for me and put your feet together and stick out your arms straight like a T. Okay? Now relax. Okay, this patient didn't have any swaying or, so it was a negative Romberg test. So that completes my head to toe assessment.